The number of new COVID-19 cases in South Korea rose today to an all-time high of more than 340,000. That's almost at the peak the authorities have said they expect to see this month. Some rules and procedures are going to change now. For example, coronavirus pills will be more widely available and some rules will be relaxed on testing. Choi Min-jung reports.
South Korea reported a record-breaking 342,446 new cases of COVID-19 on Wednesday. It's the first time the country has seen daily infections surpass the 300,000 mark. The daily caseload increased by a whopping 140,000 in just one day. Including the latest figures, the country's total caseload has now surpassed 5.2 million, or roughly 1 out of every 10 people in South Korea. The country passed the 4 million mark last weekend, and it only took 4 days to reach the 5 million mark. Health experts say the peak phase of Korea's Omicron wave may have started this Wednesday and is set to last over the next 2 weeks, with cases hovering between 250,000 to 350,000 a day. Therefore, they say the country must prepare itself for a surge in severely ill patients at the end of March or in early April. Starting Wednesday, general hospitals, psychiatric hospitals, and rehabilitation medical centers will be allowed to prescribe Pfizer's caseload to COVID-19 patients as well. Up until now, the oral treatment could only be prescribed by medical institutions, local clinics, and hospitals that were designated to treat COVID-19 patients recovering at home. From Thursday, inbound travelers will no longer have to get 2 PCR tests on the day of arrival and the 7th day after arriving. PCR tests will only be required on the day of arrival, and on the 7th day, people will be asked to take the rapid antigen test instead. Measures have also been eased for people working at nursing facilities. Those who have gotten their 4th shots will no longer have to take regular PCR tests twice a week. The move comes in a bid to increase efficiency, with demand for tests increasing due to the rapid spread of the virus. Choi Min-jung, Arirang News.